Hello, my name's Sarah Dowson and I'm a Reiki complementary therapist, and I work for the Northern Devon Healthcare Trust in Barnstable Hospital, providing Reiki for cancer patients and their families and the staff. I am funded to provide this service through a charity called the Sam Buxton Sunflower Healing Trust. They funded 36 posts in 16 trusts across the UK since they were founded in 2006. The therapists attend one of the courses that's run by the Sam Buxton Sunflower Healing Trust. This is to enable the therapist to have an understanding of giving Reiki within a hospital setting, as it's very different to the normal process that we would give Reiki. So this also gives the Sam Buxton Sunflower Trust the opportunity to meet the therapists that could be working within this role. So as well as a Reiki practitioner, I'm also a registered nurse, and I've worked within cancer services and palliative care since 2005. For the past 13 years, I've worked as a clinical nurse specialist in cancer. Patients can sometimes be connected to drips, oxygen, chemotherapy, but I can work around that. I also provide Reiki within the hospital for patients who are on the wards, not just in the Fern Centre or on the Seymour unit whilst they're receiving their chemotherapy. Patients on the wards, again, can be connected to all kinds of equipment and have relatives around them. And being able to offer them Reiki in those situations gives the patients nice, relaxing time, but it also gives the relatives some me time, and they're able to leave their loved ones just for half an hour whilst I give their treatment, and it gives them a break and some time away. So Reiki is a complementary therapy, and it works through energy being channeled through the therapist's hands. It's a very difficult thing to describe and explain to people, and it is something that people really need to experience themselves. And many people have experienced Reiki, but there are a lot of people out there who've never even heard of it. It works through the therapist channeling the energy through their hands, which is then passed through to the patient or to the person having the treatment. Reiki works by allowing the person to feel very calm, very relaxed. Reiki has many benefits, and it can benefit patients and family members and staff physically, but also for their emotional well-being. Reiki is given in a non-intrusive way, and it's using a technique called hands-on or hands-off. So my hands would either be laying on a patient or they'd be hovering above a patient, and I'd work down through their body just how I feel where I need to be. Patients and families would remain fully clothed throughout the Reiki treatment. So to start with, I would ensure that the person who is about to receive the Reiki treatment can either be sitting in a chair comfortably or lying on a couch or in their hospital bed or in the Seymour unit on their chair where they're having their treatment. So wherever they are, I just need to make sure that they're comfortable. I try and reassure them all the time because some people are not really sure what to expect. And I explain to them that they need to close their eyes, take a few deep breaths, and just allow their body to start to relax. I also have to ensure that I explain to them how I'm going to let them know that the treatment's finished, because or else I find that people are lying there waiting to know whether they can open their eyes or not. So I would just say to them, actually, when I finished, I'll just put my hand gently on your shoulder and just say your name and just tell you to, wiggle your fingers and toes and gradually come back into the room. And once they feel able to, they can open their eyes. So in this setting, it's lovely because we've got the couches all set out. Reiki can be given absolutely anywhere. Any noise that's around just seems to sort of go somewhere off into the distance. And people are able just to close their eyes and feel calm and relaxed and peaceful. And it just has an amazing sense of release and increases their emotional well-being. Sometimes clients or the recipient will have some tears, and I reassure people that that's completely normal and it's just a natural way of the body releasing any tension and any emotion that needs to come out. I've always got tissues at hand, so that's completely fine. So the recipient of the treatment very often fall asleep during their treatment, which is lovely because you can see them actually relaxing and the tension just sort of drifting away. And we remain quite quiet throughout the treatment. When the treatment finishes and they feel able to wake up, quite often what they do is express that that was weird. And I have a little bit of a chuckle because that's something that's said quite often. And I always ask them, is that weird good or weird bad? And they always look at me and say weird good. and they can't really describe what's happened to them. They just know that it felt amazing, and that's so lovely. The other thing that's really lovely is when, if the family members have left the room to allow the treatment to happen, they come back in and they can notice such a difference, and that's really, really reassuring for families to know that their loved ones are feeling more relaxed and less distressed. Every Reiki treatment is unique to the person receiving and at what time that they're having their treatment. So sometimes people need just to be calm and quiet. Sometimes there's a lot of emotion to get rid of. Sometimes people are struggling with pain, and Reiki can help with that. It also helps to enable people to have a really good sleep, and it's often reported that patients who are inpatients, particularly, who have had lots of sleepless nights, have slept really well, and that's quite often reported back to me from the staff nurses looking after them. And that's really nice to hear. It can be a really scary time, especially in the middle of the night if you're not able to sleep, but to know that somebody's had a really good sleep and that the Reiki's helped to enable that is a real positive. So Reiki is difficult to explain, and the best thing to do is to experience it for yourself. Complementary therapies, and Reiki being one of those, is offered at the Fern Centre, the North Devon Cancer Wellbeing Centre. If you would like to come in for an appointment and to have a treatment, you can be referred for this via your clinical nurse specialist, or drop in at the Fern Centre, or you can go onto the website or give them a call and they can book you in and arrange for your appointments.